One BART board member now says she has a plan that could stop scenes of graphic drug use like this inside stations and elevators. She wants to threaten the drug users with prison time.
Making that happen won't be easy. KPIX 5's Phil Mateer live at the Concord BART station. Phil?
It won't, in part because we as a state of California have changed the laws and made it tougher for the cops to do anything about the problem that seems to be growing. Let's take a look. It's scenes like this, drug users openly shooting up at BART stations, that has BART director Deborah Allen saying it's time to revisit California's drug laws.
Make the use of a hypodermic needle for illegal drug use in a transit system a felony.
Punishable by up to 18 months in jail.
This is really a public safety issue for not only the riders of BART, but this is also a workplace safety issue for our employees.
Allen pointed to a picture that aired last night on KPIX 5 of a Concord BART station agent finding someone with a needle in his arm in the elevator.
That could have been a terrible situation for her.
What frustrates Allen and others is that under a 2014 voter-approved reform of the state's drug laws, possessions and even the open injection of what were once considered felony-class drugs like heroin or methamphetamine are now misdemeanor offenses. Basically, you get a ticket.
These people are sometimes back in the station before they even get the paperwork done.
San Francisco Public Defender Jeff Adachi's office often handles those who are charged. His take?
Typically, the DA doesn't prosecute these cases. You might get some form of drug treatment and then the case is dismissed. But because they're misdemeanors, you're not going to see anyone thrown in jail for a long period of time.
But the public defender disagrees with Allen's call to bring back felony charges.
I think it's moving things in the wrong direction. I think that drug offenses should be treated as a public health problem.
I don't want to incarcerate these drug users. What I want is for them to have help. But they're not going to get help sitting on the floor of the BART station with mental health professionals sitting next to them trying to convince them to get help.
Now, we as a state decided that we wanted to decriminalize this problem because we didn't want the drug users going to jail. We wanted them to go to treatment. We didn't want them to have records. We didn't want their lives ruined. The challenge is, without the threat of jail at least, the question is, are they going to go and get that help? And that is something that BART and other law enforcement groups are grappling with. In Concord, Phil Mateer, KPIX 5, back to you.